Hi friends, welcome back. Now yesterday we were studying about the bacterial diseases, and in that first one we saw about typhoid. We saw how that typhoid is caused. We saw what are the symptoms when a person is suffering from typhoid. We also saw the treatment or the vaccine, TAB vaccine, we learned about that. We also saw the antibiotics which are given because it's a bacterial disease and antibiotics are very much effective in case of bacterial diseases. So in today's video we'll be also studying about the second bacterial disease, that is pneumonia. Now what is this pneumonia? It is the inflammation of lungs. In pneumonia, what we see is the lungs are inflamed. Now, why is this inflammation of lungs takes place, or how does it takes place? Now, this pneumonia is caused by bacteria called Streptococcus pneumoniae, or there is one more bacteria, Haemophilus influenzae. Now there are two causative agents here for causing pneumonia. One is Streptococcus pneumoniae and another one is Haemophilus influenzae. Now these bacteria, when they enter the respiratory tract, they attack the alveoli. Now keep in mind, now we are talking about pneumonia. These bacteria are going to enter the respiratory tract through nasal cavity. They are not going to attack the respiratory tract region, but instead they are going to attack the lungs. In lungs, they are going to attack the alveoli. So what happens here? Once the person is infected by these bacteria, there is these alveoli which gets blocked by the growth of these bacteria inside the alveoli, and they formed fluid filled spaces. These alveoli, we have learned this. These are the regions where the exchange of gases is taking place. We have learned in the 11th standard that there is this blood capillary. These are alveoli, and the carbon dioxide is given out and oxygen is taken in. We have learned these things, right? Yes. So here, now this region is where the bacterial growth starts, and these get filled with fluids. As a result, the exchange of gases is not possible, and in some cases there is inflammation. So what we see in pneumonia is inflammation of lungs because of the fluid filled alveolar sacs. Also, in some cases we see that since there are blood capillaries very much near, they may get ruptured and there is also blood seen here, right? So in pneumonia, the causative agents are Streptococcus pneumoniae and Haemophilus influenzae. What are the symptoms of pneumonia? A person suffering from pneumonia may experience the following symptoms. First one is high fever. He may also experience chills, cough, heavy breathing, and in severe cases the lips and nails turn bluish. If it is a serious infection, the symptoms is the lips and nails would turn bluish, or in some cases it may also turn grey, or we may also see that they have turned grayish in color. Okay. So what are the symptoms in pneumonia? They experience high fever, they experience chills, they experience cough, heavy breathing, lips and nails may turn bluish or grey in severe cases. Okay, so these are the symptoms of pneumonia. Is there any vaccine, or before that we will see how it spreads. How does this bacteria spread from one person to another person? Now, it spreads through air. Now, when we say this pneumonia is airborne, if the person is suffering from pneumonia, if he is infected by the bacteria, what happens is if he coughs or sneezes, the aerosols. What are these aerosols? These are the fine droplets. When we sneeze or when we cough, there are fine droplets. These are coming out of the nasal cavity or the mouth region. Now these, if inhaled by another person, the person may also contract these bacteria and may also suffer from pneumonia. So it is airborne. It spreads from one person. It is infectious. It spreads from one person to another person through air, through aerosols. Now keep this in mind. Okay? Now the best way in which we can prevent ourselves is by maintaining hygienic condition. The person who is suffering has to cover his mouth with handkerchief or like this with the elbow region while sneezing or coughing. Okay, so these are the common practices. Now here we may see that this pneumonia can spread in two ways, or there are two types which we usually talk of. One is the community spread. Now what is this community spread? Now this is where the infected person, if he is outside in the community, not in the hospital, let us say if he is roaming around, okay, so there if he sneezes, if these aerosols are breathed by another person or a healthy person, he may contract that disease. Now with this type we call it as a community spread. The other kind is where it can be spread through hospitals. Now this is a severe kind. Now what happens is, say suppose a person has been admitted to hospital for some other reason other than this pneumonia, and he has a nearby patient who is suffering from pneumonia. If he gets the bacteria from this patient, then the condition would be severe. In these cases, through hospital spreading, the conditions are severe. The treatment is quite difficult, because already if the person who is suffering from other disease, his immune system will be weak, right? So in that case, the treatment is quite difficult. Now, is there any vaccine available? Now usually we call it as an incubation period. Now this Streptococcus pneumoniae or Haemophilus influenza, it takes about 1 to 3 days to multiply or show its symptoms. Now if prior to this, if the person is given a vaccine, what vaccine it is? We have got pneumococcal conjugate vaccine 13, PCV 13, pneumococcal conjugate vaccine 13. It prevents up against 13 types of bacteria. Now what vaccine is given here? PCV. Now this prevents against the 13 types of bacteria. Okay. If he is given with, if the person is given this vaccine, he may be prevented he may have immunization against this pneumonia causing bacteria. Okay, apart from that, if the person has not taken the vaccine, if he is not vaccinated, then is there any antibiotic which can treat? The antibiotics are erythromycin, or there is one more, tetracycline. Now these two antibiotics, they are used in the treatment of the pneumonia. Now why we are saying antibiotics? Because the bacteria, it is a bacterial infection, and antibiotics work very well against these bacterial infections. Now these are the two cases which we have studied as per the NCERT book. Now apart from these, there are certain other bacterial infections and their causative agents I have listed. The first one is bubonic plague, or we call it as a black death. It is caused by Pasteurella or Yersinia pestis. Now here the spelling written is Yersinia, but how do you pronounce it? It is Yersinia. Okay. The second one is tuberculosis. It is caused by Mycobacterium tuberculosis. The third bacterial disease is leprosy. It is caused by Mycobacterium leprae. Leprosy is caused by Mycobacterium leprae. Tetanus. It is caused by Clostridium tetani. Now we always take a tetanus injection if we have a cut or a wound, right? Yes. So as anthrax is caused by Bacillus anthracis, and the last one, scarlet fever, it is caused by Streptococcus. Now here I am going to discuss three kinds of tests, or I am just telling you about three kinds of tests, so that if a question is asked in exam, you should be you can easily answer it. What is that question, or what kind of questions can be asked? Now in case of this bubonic plague or black death, the kind of confirmatory test is Wiesen test. I'll write it down here. In the first case, the kind of test we see is Wiesen test. It is a confirmatory test done to confirm the plague. Now here, in the second case, that is tuberculosis, we see Mantoux test. For confirming tuberculosis, Mantoux test is done. And the third one is scarlet fever, in which there is Dick test is carried out to confirm this scarlet fever. Now we have studied four kinds of tests here. One is the Weidel test or Weidel test, Wiesen test, Mantoux test, and Dick test. Now here you may get a question on these tests, or the causative organisms, or the diseases. So keep in mind to remember all these things. Fine. So today we will stop it here. In the next video we will study about the viral diseases. Fine. Thank you.